Right. I am going to get straight to the point today, because this is something that every single dog owner needs to hear. There is a very real chance that something is living inside your dog right now, or on your dog, feeding off them, and your dog has absolutely no way of telling you.
Parasites, internal ones, burrowing through your dog's intestines right now, feeding on the nutrients your dog should be absorbing. External ones, hiding deep in the coat, feeding on blood, potentially passing serious disease into your dog, and in some cases into your family, without a single obvious warning sign. In 25 years of veterinary practice, parasites are one of the most consistently underestimated threats to dog health that I encounter. And today, we are going to change that completely. Because what you learn in this video could make a real difference to your dog's life. So grab a cup of tea or coffee, depending where you're watching from, and stay with me. Because what you learn in this video could make a real difference to your dog's life. In 25 years of practice, this is one of the things I see owners underestimate most consistently. So today, we're going to go through all of it together. What these parrots are, what they do, how you treat them, and how you make sure your dog never has to deal with them in the first place. So grab a cup of tea or coffee, depending where you're watching from, and let's get into it. Here is something that genuinely surprises a lot of dog owners when I tell them. A dog can be carrying a significant worm burden, hundreds of worms living and feeding inside its intestines, and on the outside, look and behave completely normally. No obvious signs at all, at least not in the early stages. But as that worm burden grows, and it will grow because these parasites reproduce inside your dog's body at a remarkable rate, the clinical signs begin to appear. And once you know what to look for, they become very difficult to miss. So let me walk you through them, because this is where it gets really interesting. And one of the most striking things you will notice, particularly in puppies with a heavy worm burden, is what we call potbelly syndrome. That little puppy looks well fed, even plump around the abdomen, but it is not fat. Those are worms. And that distinction matters enormously, because what that puppy actually is malnourished. The worms are eating first, every single time. Now, I want to show you two presentations that I see coming through my door regularly, and both of them tell me the same story, even though they look completely different from the outside. On my left here, a puppy with a massively distended abdomen, and on my right, an adult dog that is visibly wasting away. Same underlying problem, two very different faces of it. They have several causes, but a heavy parasite burden is one of the most common ones I see, particularly roundworms and hookworms. What's happening is the parasites are causing such significant protein loss and nutritional depletion that the body can no longer maintain the fluid balance in the tissues. The fluid leaks into the abdominal cavity instead. And what you're left with is this: a puppy that looks bloated and well fed on the outside, but is in fact severely malnourished and in real distress on the inside. And then there's this presentation, the dog that is just wasting away in front of its owner's eyes. Prominent ribs, spine clearly visible, hip bones jutting out, coat dull and lifeless. Hip bones jutting out, coat dull and lifeless, muscle mass just gone. The owner is feeding this dog. The owner is doing everything right, but the dog keeps losing weight. And the reason, more often than not, is that every nutrient going into that dog is being intercepted. The parasites are feeding first. Your dog is getting the leftovers, and over time, there are no leftovers left. Both of these dogs are telling us something important. The bloated abdomen and the wasting body are two ends of the same spectrum, and both of them are signs that the parasite burden inside has reached a point where the dog's body simply cannot compensate any further. These are not mild cases. These are what happens when parasite control is absent or inadequate over a significant period of time. Now, beyond the belly and the weight loss, there are other clinical signs I want you to know about. Chronic diarrhea, sometimes with visible worm segments or blood. Vomiting, occasionally with worms present, which is as alarming as it sounds. Scooting along the floor, which tells me there is perianal irritation from tapeworm segments. A persistently dull, rough, poor condition coat. Anemia, particularly with hookworm infestations, where the dog becomes pale, weak, and breathless because the worms are literally drinking its blood. And in puppies especially, a pater is stunted growth. A puppy that simply isn't developing at the rate it should because the nutrition it needs is being stolen before it can use it. And here's what I really want you to take from this lecture. These presentations, the bloated puppy, the wasting dog, the anemic, breathless animal, none of them happen overnight. They develop gradually, quietly, over weeks and months, which is exactly why regular parasite screening and consistent prevention are so important. Because by the time the signs become this obvious, The parasites have already been there for a very long time, and your dog has been suffering quietly the whole time. So how does a dog actually pick these parasites up in the first place? Because that's the question I get asked most often, and the answer is honestly more straightforward than most people expect, which is part of what makes it so hard to avoid without a consistent prevention program in place. The most common route in puppies is transmission from the mother, either across the placenta before birth or through the mother's milk during nursing. This is why I always say, assume every new puppy has worms, because the overwhelming majority of them do, regardless of how well cared for the mother was. It is simply biology, and it is why worming from 2 weeks of age is non-negotiable. In older dogs, the most common route is environmental, contaminated soil and feces. A dog sniffs contaminated ground, licks, ingests microscopic worm eggs, and those eggs travel straight into the intestines. And those eggs travel straight into the digestive system, where they hatch, develop, and begin the cycle all over again. This happens in parks, gardens, pavements, anywhere.
And those eggs travel straight into the digestive system where they hatch, develop, and begin the cycle all over again. This happens in parks, gardens, pavements, so it's crucial to maintain good hygiene for your pets, anywhere an infected dog has been. And those eggs can survive in soil for months, sometimes years. Dogs that hunt or scavenge, eating infected rodents, rabbits, or birds, can pick up tapeworms, trachs, or burrs, can pick up tapeworms directly from the carcass. And contaminated water sources, puddles, ponds, shared water bowls, are a surprisingly common transmission route for several parasite species. Even a dog that never leaves its own garden is not completely protected if wild animals pass through that space. And here is something that I think is really important for families to understand, particularly families with young children. Several of these parasites are zoonotic. That means they can transfer from your dog to a human being. Roundworm larvae in particular can migrate into human tissue, causing a condition called toxicariosis, which in rare cases can affect the eyes and the nervous system. Children who play on contaminated ground and then put their hands in their mouths are the most vulnerable group. This is not something to take lightly. So when I talk about parasite prevention, I am not just talking about your dog's health. I am talking about your family's health too. And that changes the conversation entirely, because this is not optional. This is something every responsible dog owner needs to have a consistent plan for. And that plan, we are going to build together right here in this video.
Welcome back to the Vet Files. I'm Dr. Alistair Pemberton, and if this is your first time here, welcome. This channel is built around one simple idea: giving pet owners like you the clearest, most honest veterinary advice I can, based on 25 years of real clinical experience. Today's video is one that I have genuinely been looking forward to making, because parasites are one of those topics that every pet owner needs to understand, and yet it is one of the most consistently misunderstood areas of pet health that I encounter in my clinic. Owners either don't know enough about it, they think it doesn't apply to their pet, and both of those positions, I'm afraid, can cause real harm. So here is what we are going to cover today. We are going to start with endoparasites, the ones living inside your dog. Roundworms, tapeworms, hookworms, whipworms, and heartworm, what they are, what they do, what the clinical signs look like, and what the implications are if they go untreated. Then we move to ectoparasites, the ones living on your dog. Fleas, ticks, mites, and lice. Again, clinical signs, implications, and everything you need to know. And then we bring it all together with a full treatment and prevention guide. The products I actually recommend to my clients here in the US and across the UK, the schedules you need to follow,
and the things that I think every dog owner should have as a standard part of their pet care routine. By the end of this video, you will have a complete parasite management plan for your dog, built on real clinical evidence, not guesswork. Now, before we get into the detail, I want to say something that I say to every new client who comes through my door with a dog. Parasites are not a reflection of how clean your home is, how careful you are, or how much you love your pet. They are an incredibly common part of dog ownership, and the owners who manage them best are simply the ones who are informed and consistent. That is all this is about, knowledge and consistency. So, let's get into it. We are going to start right at the beginning with the most common internal parasite I see in dogs of all ages, and one that, as we touched on earlier, almost every puppy is born already carrying the roundworm. And I promise you, by the time we are done with this video, you will never look at your dog's belly quite the same way again.
Now we've talked about what's happening on the inside, the worms, the potbelly, the ascites, the wasting dog. But I want to turn our attention now to what's happening on the outside. Because ectoparasites, the parasites that live on your dog's skin and coat, are just as dangerous, just as common, and in many cases even more difficult to spot than you'd expect. The 4 ectoparasites I want to cover today are fleas, ticks, mites, and lice. Now, every single one of these does far more than simply cause discomfort. Each one has its own mechanism of damage, its own set of clinical signs, and its own range of diseases that it can either cause directly or transmit into your dog's system. So let's go through them one by one, starting with the one I see most consistently in my clinic, the flea. Fleas are small, wingless, incredibly fast-moving insects that feed exclusively on blood. A single flea can bite your dog up to 400 times in a single day. 400 times. And for every flea you can see on your dog, there are approximately 95 more in various life stages: eggs, larvae, pupae, living in your carpets, your furniture, your dog's bedding. The flea you see on your dog is quite literally the tip of the iceberg. Now, the clinical signs of flea infestation go well beyond simple scratching. Yes, you will see intense itching and scratching, particularly around the base of the tail, the groin, and the abdomen.
What many owners don't realize is that fleas cause a condition called flea allergy dermatitis, where the dog develops a hypersensitivity reaction to the flea's saliva. Just one flea bite in an allergic dog can trigger severe, widespread skin inflammation, hair loss, hot spots, and open sores that become infected. It is genuinely miserable for the animal. But the implications go even further than skin disease. Heavy flea infestations, particularly in puppies and small dogs, cause anemia. Those fleas are drinking blood continuously, and a small puppy simply does not have enough blood to spare. I have seen puppies come in pale, weak, breathless, and close to collapse from flea anemia alone. And beyond anemia, fleas are the intermediate host for the tapeworm Dipylidium caninum, meaning a dog that swallows an infected flea while grooming will develop a tapeworm infestation as a direct result. The two problems feed each other, quite literally. And one more thing about fleas before we move on, they bite humans too. If your dog has fleas, your home has fleas, and your family is at risk of bites, skin reactions, and in rare cases, disease transmission. This is never just a dog problem. It is always a household problem. And it requires a household solution, which we will get to in full detail when we cover treatment and prevention. But first, let's talk about something that I consider even more dangerous than the flea: the tick.
Now let's talk about the tick. And I want to be very straightforward with you here. Because of all the ectoparasites I deal with in my clinic, the tick is the one that concerns me most
Now let's talk about the tick. And I want to be very straightforward with you here. Because of all the ectoparasites I deal with in my clinic, the tick is the one that concerns me most.
At a disease transmission standpoint. Not because it is the most common, fleas hold that title comfortably, but because of what a tick is capable of putting into your dog's bloodstream while it feeds. A tick is an 8-legged arachnid, more closely related to spiders than to insects. It feeds by burying its mouth parts, called a hypostome, directly into your dog's skin and anchoring itself there with tiny backward-facing barbs that make it extremely difficult to remove cleanly. It then feeds slowly on blood, sometimes for several days, before dropping off. And it is during that feeding process that disease transmission occurs. The diseases that ticks transmit are serious. In the United States, the most significant is Lyme disease, caused by the bacterium Borrelia burgdorferi and transmitted primarily by the deer tick. The diseases that ticks transmit are serious. In the United States, the most significant is Lyme disease, caused by the bacterium Borrelia burgdorferi and transmitted primarily by the deer tick. Lyme disease in dogs causes fever, severe joint pain and swelling, lameness that shifts from leg to leg, lethargy, loss of appetite, and in advanced cases, kidney failure, which can be fatal. And Lyme disease does not just affect your dog. It affects humans too. The same tick that bites your dog can bite you. Beyond Lyme disease, ticks transmit a range of other serious conditions. A bigger acidic infection that destroys red blood cells, causing severe anemia, fever, jaundice, and in some cases. So, we have Lyme disease, anaplasmosis, and ehrlichiosis. These are the big 3 tick-borne diseases you need to watch out for. Prevention is absolutely key. Case is organ failure. Ehrlichiosis, a bacterial infection attacking the white blood cells, causing bleeding disorders, eye inflammation, and neurological signs. Anaplasmosis, similar presentation to ehrlichiosis, with joint pain, fever, and lethargy. And in the UK specifically, we also see tick-borne encephalitis in certain regions, a viral infection affecting the brain and nervous system. Anaplasmosis, similar presentation to ehrlichiosis, with joint pain, fever, and lethargy. And in the UK specifically, we also see tick-borne encephalitis in certain regions. a viral infection affecting the brain and nervous system. Now, if you find a tick on your dog, the most important thing is to remove it correctly and promptly, because disease transmission risk increases significantly the longer a tick remains attached. Use fine-tip tweezers or a dedicated tick removal tool. Grip as close to the skin as possible and pull steadily upward with even pressure. Never twist, never crush, never apply petroleum jelly or heat. All of those methods increase the risk of the tick regurgitating infected material into the wound. Straight out, clean and steady, that is the technique. After removal, clean the bite site with an antiseptic wipe and monitor your dog closely over the following days and weeks. Any fever, lameness, lethargy, or loss of appetite following a tick bite, call your vet immediately and mention the tick. Early treatment of tick-borne disease makes an enormous difference to the outcome. And in the treatment section of this video, I will be giving you my specific recommendations for tick prevention products available right now in both the UK and the US. Because prevention, as always, is far better than the alternative. Now I want to talk about mites. And if the flea surprised you and the tick concerned you, mites are the ectoparasite that I find are most of my aroused, because unlike fleas and ticks, mites are microscopic. You will never see them with the naked eye. But the damage they cause to your dog's skin that you will absolutely see, and it can be quite confronting when you do. The first mite I want to cover is Sarcoptes scabiei, the cause of sarcoptic mange, also known as scabies. This mite burrows directly into the outer layers of your dog's skin, literally tunneling through the tissue, where it feeds, lives, and lays its eggs. And the body's immune response to this invasion is what causes the clinical signs, the intense, almost unbearable itching, the skin inflammation, the hair loss, the thick and crusty skin that develops particularly around the ears, elbows, hocks, and face. The itching with sarcoptic mange is so severe that dogs will scratch and bite at themselves relentlessly, to the point of creating open wounds and secondary infections. Bacterial skin infections on top of the mange itself. I have seen dogs come in having scratched themselves raw overnight. And here is something critically important. Sarcoptic mange is zoonotic. It can transfer from your dog to you. In humans, it causes an intensely itchy rash, most commonly on the arms, chest, and abdomen. If your dog has scabies and you are developing an unexplained itchy rash, please see your doctor and mention your dog. The second mite is Demodex canis, the cause of demodectic mange. Now, this one is slightly different in an important way. Demodex mites actually live normally in small numbers in the hair follicles of healthy dogs. They are part of the normal skin flora. The problem arises when the immune system is weakened. In young puppies, whose immunity is still developing, in dogs on immunosuppressive medications, or in dogs with underlying illness. When immune control is lost, the Demodex population explodes, and that is when we see the classic patchy hair loss, skin thickening, secondary infections, and in severe cases, generalized whole body involvement that can be genuinely life-threatening. And then there are ear mites, Otodectes cenotus. These live and feed inside the ear canal, causing intense irritation, a characteristic dark brown waxy discharge that looks very much like coffee grounds, head shaking, ear scratching, and in severe cases, secondary bacterial and yeast infections deep inside the ear canal. Left untreated, chronic ear mite infestations can cause permanent damage to the ear canal and in extreme cases affect hearing. They are highly contagious between animals. If one pet in your household has ear mites, every other pet needs to be checked and treated simultaneously. Mites are diagnosed through skin scrapes, tape preparations, and ear swabs examined under the microscope. So if your dog is showing any of the signs I have described today, please don't try to manage it at home with over-the-counter products. Get a proper diagnosis and get the right treatment started. Mange in particular can escalate very quickly if it is not treated correctly and promptly. And in our treatment section coming up shortly, I will walk you through exactly what we use and what works. But first, let's talk about the last of our 4 ectoparasites. And now we come to the last of our 4 ectoparasites, and honestly, the one that tends to surprise owners most when I bring it up.
Because when most people hear the word lice, they think of children and school outbreaks. They don't think of their dog. But canine lice are a very real clinical problem, and one that is significantly underdiagnosed simply because owners and even some vets don't always think to look for them. Dogs can be affected by 2 distinct types of lice. The first is Trichodectes canis, the chewing louse. This one feeds on skin debris, dead skin cells, and surface secretions rather than blood. The second is Linognathus setosus, the sucking louse. This one feeds directly on blood, piercing the skin and drawing blood continuously. And as you can imagine, those 2 feeding mechanisms produce somewhat different clinical pictures, though there is significant overlap in the signs you will see. Now, unlike mites, lice are actually visible to the naked eye if you know what to look for. though they are small enough that most owners miss them entirely. What you are looking for are tiny pale yellowish insects moving slowly through the coat, and their eggs, called nits, which are cemented firmly to the hair shafts and look like tiny white or yellowish specks that do not brush off the way dandruff does. If you part the coat and look carefully in good light, particularly around the ears, neck, shoulders, and around the base of the tail, that is where you are most likely to find them. The clinical signs of lice infestation include intense itching and scratching, particularly around the head, neck, and ears, a dull, dry, matted coat that loses its normal sheen and texture, patchy hair loss in areas of heavy infestation. Restlessness. Dogs with lice are genuinely uncomfortable, and it shows in their behavior. And with sucking louse infestation specifically, anemia, because that continuous blood feeding adds up significantly over time, particularly in puppies and small dogs where the blood volume is already limited. I have seen young puppies become genuinely anemic from lice alone. Lice are spread through direct contact between animals, grooming, playing, sleeping together, shared bedding, and shared grooming equipment. They are species-specific, meaning canine lice cannot survive on humans, which is one reassurance I can offer you today. Unlike sarcoptic mange, you will not catch lice from your dog. However, if one dog in a multi-dog household has lice, every dog in that household needs to be treated simultaneously, because lice spread between dogs with remarkable efficiency, and retreating only one animal while others remain infested guarantees reinfestation. So there we have our 4 ectoparasites: fleas, ticks, mites, and lice. Each one different in its biology, its feeding mechanism, and the diseases it causes, but all 4 sharing one thing in common. They are all entirely manageable with the right prevention program in place. And that is exactly what we are going to build together right now. Because we have spent enough time talking about what these parasites do to your dog. Now let's talk about how we stop them.
Right, this is the part of the video I know a lot of you have been waiting for, because we have spent a good amount of time understanding what these parasites are, what they do, and the very real damage they can cause. And now I want to give you something genuinely practical. A complete treatment and prevention plan that you can take away from this video and start implementing for your dog today. Now I want to be clear about something before we get into the specific products. There is no single magic product that covers every parasite your dog will ever face. What there is a layered, a consistent approach that addresses both internal and external parasites on a regular schedule. And that layered approach is what I am going to walk you through right now, starting with endoparasite treatment and then moving through to ectoparasite control. For endoparasites, worms, the cornerstone of treatment and prevention is regular deworming, and I cannot stress enough how important the word regular is here. A single deworming treatment does not provide ongoing protection. It treats the worms present at the time of treatment, and that is all. Your dog can be reinfected the very next day it goes outside. This is why I recommend a scheduled, consistent deworming program, and I am going to give you that schedule in detail right now.
For puppies, deworm at 2 weeks of age, 4 weeks, 6 weeks, and 8 weeks, then monthly until 6 months old. From 6 months onwards, every 3 months for life. That is your baseline deworming schedule, and it applies to the vast majority of dogs. However, dogs that hunt, scavenge, eat raw food, or have regular contact with children should be dewormed more frequently, every 4 to 6 weeks, because their exposure risk is significantly higher than the average pet. In terms of specific products, in the UK, the products I recommend most consistently are Drontal, which covers roundworms, tapeworms, hookworms, and whipworms in a single tablet, and Malbamax, which I particularly like for puppies due to its palatable small tablet size and broad-spectrum coverage. In the US, I recommend Interceptor Plus, which covers roundworms, hookworms, whipworms, tapeworms, and crucially heartworm prevention in a single monthly chewable. And Sentinel Spectrum, which adds flea egg prevention on top of the same worm coverage. Both are prescription products, which means your vet needs to be involved. And I think that is entirely appropriate. Now, a quick but important note on heartworms specifically, because it deserves its own mention. Heartworm is transmitted by mosquitoes and causes adult worms to develop inside the heart and major blood vessels. It is a serious, potentially fatal condition, and in the United States particularly, it is prevalent enough that year-round heartworm prevention is something I recommend, without hesitation, to every dog owner. Monthly preventatives like HeartGuard Plus or Interceptor Plus are highly effective, but they must be given consistently every single month without gaps. A gap in coverage is a gap in protection, and with heartworm, that gap can cost your dog its life. Now let's talk about ectoparasite control, the external parasites: fleas, ticks, mites, and lice. And just like with the internal parasites, what we are building here is not a one-time fix. It is a consistent, layered program that keeps those parasites off your dog and out of your home. Because as I mentioned earlier, By the time you see a flea on your dog, 95% of that flea population is already living in your environment. Let's start with what I consider the most practical and effective category of ectoparasite treatment available today: the spot-on pipettes and oral chewables. These have genuinely revolutionized parasite control over the last decade, and the products available now are significantly more effective than anything we had 20 years ago. In the UK, Advocate is one I recommend regularly. It covers fleas, mites, lice, and some worms in a single monthly spot-on application. Stronghold is another excellent option, covering fleas, ear mites, sarcoptic mange, and heartworm. Both are prescription products available through your vet. In the US, the oral chewables have become my go-to recommendation for most dog owners, particularly NexGard and Bravecto. NexGard is a monthly beef-flavored chewable that kills fleas and ticks with impressive speed. Fleas within 4 hours, ticks within 24 to 48 hours. Bravecto gives you 12 weeks of flea and tick protection from a single chewable, which I find particularly convenient for owners who sometimes struggle with monthly schedules. Simparica Trio is another one I recommend in the US. It combines flea and tick control with heartworm coverage in one monthly chewable. A genuinely impressive product. Now let's talk about flea collars, because they have improved enormously in recent years and they deserve a mention. The Seresto collar in particular, available in both the UK and the US, provides 8 months of continuous flea and tick protection, and I think it is a genuinely excellent option, particularly for owners who find monthly spot-ons or tablets difficult to remember. It works through slow release of 2 active ingredients, available in both the UK and the US, provides 8 months of continuous flea and tick protection. I think it is a genuinely excellent option, particularly for owners who find monthly spot-ons or tablets difficult to remember. It works through slow release of 2 active ingredients, imidacloprid for fleas and lice, and flumethrin for ticks, distributed through the coat and skin over those 8 months. It is not a substitute for a full parasite program, but as part of one, it is a very solid addition. For mites specifically, sarcoptic mange and demodectic mange, treatment goes beyond the standard flea and tick products and typically requires prescription treatments. Bravecto and NexGard have
both shown good efficacy against sarcoptic mange, and in more severe cases we use licensed treatments like Advocate or injectable doramectin under veterinary supervision. Demodectic mange treatment depends on severity. Localized cases in puppies often resolve with immune system maturation, but generalized cases need consistent long-term treatment and regular monitoring. This is absolutely a condition to manage with your vet, not at home. And one thing I want to make absolutely clear before we move on: treating your dog is only half of the ectoparasite battle. Because as we established with fleas, 95% of that population is in your home, not on your dog. So treating the dog without treating the environment is like mopping the floor with the tap still running. In the next part of this video, I am going to show you exactly how to treat your home environment effectively. Because without that piece, even the best product on your dog will struggle to break the flea life cycle completely.
Right, so we've covered what the parasites are, what they do, and the specific products that treat and prevent them. Now I want to bring it all together into something you can actually use. A practical year-round prevention calendar that takes away any confusion about when to do what and how often. Because in my experience, the owners who manage parasites best are the ones, again, who have a clear, simple routine. Not the ones with the most expensive products, the ones with the most consistent plan. January through March, winter months in the UK and much of the US. Deworm your dog every 3 months as standard, so if you dewormed in January, your next dose is April. Now, a lot of the owners think flea and tick treatment can be relaxed in winter, and I understand why, because flea and tick activity does reduce in colder months. But it does not stop. Fleas survive perfectly well in centrally heated homes year-round, and in the southern United States especially, ticks are active every single month of the year. So my recommendation is year-round flea prevention. No gaps, no seasonal breaks. April through June, this is when parasite activity really starts to pick up in the UK and across the northern US. Tick season begins in earnest from March onwards in most regions, so if you have been using a product that only covers fleas, now is the time to make sure your prevention covers ticks as well. April is also a common deworming month for dogs on the quarterly schedule, so deworm in April, next dose in July. And if your dog spends any time in areas with standing water or long grass during these months, I would consider increasing tick checks after every walk, regardless of what prevention product they are on. July through September, peak parasite season. This is when I see the highest number of flea infestations, tick-borne disease cases, and mite presentations coming through my clinic. Flea prevention absolutely must be consistent and uninterrupted through these months. Deworm again in July if you are on the quarterly schedule. And for US dog owners, if you are in a heartworm endemic region, which covers the vast majority of the continental United States, your monthly heartworm preventative must not miss a single dose through the summer months when mosquito activity is at its peak. This is the most critical window of the year for heartworm transmission. October through December, activity is winding down, but prevention continues. Deworm again in October on the quarterly schedule. Keep flea prevention running. As I mentioned, centrally heated homes are a flea's ideal winter environment, and I see just as many flea infestations in November and December as I do in summer in some years. Tick activity reduces in the UK through November and December, but does not disappear entirely, particularly in mild winters. And as the year closes, take a moment to review your dog's annual parasite history with your vet. Discuss what worked, what needs adjusting, and go into the new year with a clear plan already in place. The single most important thing I want you to take from this calendar is this. Parasite prevention is not something you do when you remember or when you notice a problem. It is something you build into your routine, like brushing your dog's teeth or renewing your pet insurance. Consistent, scheduled, year-round. That is the standard. And the dogs that thrive, the ones that come through my door, healthy, bright-eyed, and full of energy year after year, they all have owners who understood that. So now you do too.
Before I let you go today, I want to leave you with a few final pieces of advice. Things I genuinely believe every dog owner should hear when it comes to parasite management. Not as a checklist, I believe make the difference between a dog that thrives and one that spends more time in my consulting room than it needs to. The first thing is this. Please don't wait until you can see a problem before you start thinking about parasite prevention. By the time the signs become obvious, those parasites have already been there for quite some time. And in that time, they have been quietly taken from your dog. Prevention is always easier, always cheaper, and always kinder than treatment. Second, please have a conversation with your vet before you choose a parasite product. I know there are a huge number of options out there, and the choice can feel really overwhelming when you are standing in a pet shop looking at a wall of different products. But your vet knows your dog, knows your local area and the specific risks that come with it, and can point you toward the right product for your individual animal rather than a generic option that may or may not be the best fit. And third, treat your home as well as your dog. I mentioned earlier that for every flea you can see on your dog, there are roughly 95 more living in your home environment. And the same principle applies across the board, whether we are talking about flea eggs in the carpet, lice on a grooming brush, or mite debris in your dog's bedding. If you treat the dog and leave the environment untouched, you are simply setting yourself up for the same problem to come back around. Wash the bedding, vacuum thoroughly, use the right household products, and make sure every pet under your roof is covered at the same time. And here is the last piece of advice I want to leave you with, and I need you to really hear this one. Because in 25 years of sitting in this chair, this is the single thing that separates the dog owners whose pets thrive from the ones who end up in my consulting room more often than they should. Pay attention to your dog. That is it. You live with that animal every single day. When it becomes impossible to ignore. Early. Because early action saves dogs. Every single time. So, we have been through a lot together in this video. Endoparasites stealing nutrition from the inside. Ectoparasites feeding on blood from the outside. The bloated puppy, the wasting dog, the flea-infested home, the tick that transmits Lyme disease. We have covered the treatments, the products, the schedules, and the prevention calendar. And what I want you to feel right now, walking away from all of
what I want you to feel is completely, genuinely prepared. Because you are. And that preparation right there is what keeps your dog healthy, happy, and by your side for as long as possible. Now, if this video has given you even one thing that you are going to take away and use for your dog, I have one simple ask. Hit that subscribe button right there on your screen. 1 second at your time. Because what that button does is make sure that every video I put out, every piece of genuinely useful veterinary knowledge I share on this channel lands directly with you first. And given everything we still have to cover, I promise you, you are going to want to be there for it. Because here is what this channel is, and what it will always be. Real veterinary knowledge from real clinical experience. No sponsored content telling you what to buy. No vague advice designed to cover all bases without actually helping anyone. Just honest, clear, evidence-based information delivered the way I would deliver it to any client sitting across this desk from me. That is the standard I hold myself to on every single video. And that standard, I promise you, is never going to change. And one more thing. If you know someone who has just brought a puppy home, or a friend whose dog has been scratching for weeks and they cannot figure out why, or a neighbor who has never once thought about a parasite prevention program, please share this video with them right now, because somewhere out there is a dog owner who does not yet know what you now know. And the information in this video, shared at the right moment, could genuinely change the outcome for their dog. That is not an exaggeration. That is just the truth of it. I'm Dr. Alistair Pemberton, and it has been a genuine pleasure going through all of this with you today. In the next video, we are moving into the world of cats, and I have got a topic lined up that I think is going to genuinely surprise a lot of cat owners. It is one of the most commonly misunderstood areas of feline health, and we are going to go through it in exactly the same depth and detail we have covered today. So make sure you are genuinely surprise a lot of cat owners. It is one of the most commonly misunderstood areas of feline health, and we are going to go through it in exactly the same depth and detail we have covered today. So make sure you are subscribed and your notifications are on, because you do not want to miss that one. Until then, keep that prevention program consistent. Keep paying attention to your dog, and remember, so grab a cup of tea or coffee depending where you're watching from. Go and give your dog a good check over. You now know exactly what you are looking for, exactly what it means, and exactly what to do about it. I will see you in the next one.